All right, very good. So today I'll be discussing nutrient depletion and medications. What you need to know about nutrient medication depletion and medication, right? So you see, in our pursuit of wellness, we often turn to medications to alleviate ailments and improve our health, right? So the fact of the matter is that there are basically three reasons why we take drugs. Three reasons. One, we take drugs to replace deficient chemicals in our system. These chemicals can be vitamins, it can be minerals, it can be hormones. So we take drugs essentially to, replace deficient chemicals in our system. And another reason why we take drugs is for the drug to interfere with our cell functions. There are some drugs that increase cell activity. There are some that decrease cell activities, as in the case of agonists and antagonists, right? Now, another reason why we take drugs is basically to either kill or inhibit the growth of microorganisms, as in the case of antibiotics, right? That being said, it is pertinent to mention that there is a relationship that exists between medications and nutrient depletion. So anytime we take medications, it depletes a certain kind of nutrient in our system. And it becomes important for us to understand this. So today, I'll be walking us through some of these medications that deplete nutrient in our system and what we can do to replenish this depletion, right? So let's go straight to analgesic, right? Let's go straight to analgesic. Acetaminophen or Tylenol is frequently recommended for fevers and headache, right? So glutathione levels may be lowered by Tylenol, particularly if you have a genetic predisposition to lower glutathione production. And the matchless, functions of glutathione. Glutathione is an essential antioxidant and it aids in the body's toxic detoxification. So anytime you are on analgesic, it is advisable that you add foods high in glutathione. You know, you add food high in glutathione. Notably, you can take cruciferous vegetables, you can consume garlic, you can consume onion. So anytime you are taking analgesic, it is always advisable that you supplement it with, these fruits I have just mentioned, right? Now, we talk about corticosteroids, right? One common drug for managing inflammation is prednisone. Prednisone may inhibit the effect of vitamin D3 and reduce the absorption of calcium. So additionally, some people might lose more potassium. So for healthy bones, calcium and vitamin D3 are essential, you know that. Therefore, anytime corticosteroids are taken, meal high in calcium and vitamin D3 should always be available. Should always be available. So anytime you are taking corticosteroids, you should equally, put alongside, calcium-rich food, adequate vitamin D3. You can get that from oily fish, and then you monitor your potassium status, right? Now, let's jump right into beta blockers. A medicine called Coreg is used to lower blood pressure and slow heart rates. Melatonin levels may be lowered by Coreg, which may be the reason why many older adults have trouble falling asleep. Remember, melatonin can come from two sources, from your pineal gland and then from your mitochondria, as in the case of subcellular melatonin. In fact, 80% of your melatonin, you know, come from the subcellular level, comes from the mitochondria, right? So you can see that beta blocker should always be taken with foods high in tryptophan, such as garlic, black seeds, pumpkin seeds, and beetroot. So anytime you are on beta blockers, keep alongside tryptophan-rich foods, beetroot, pumpkin seed, garlic, black seed, right? Now we jump right into benzodiazepines. You know, Ativan, often known as the lorazepam, is frequently used to treat anxiety and other off-label illnesses. Again, we talk about melatonin, which is essential for assisting your body in resetting its circadian rhythm or circadian cycle and facilitating easy sleep, can be lowered by Ativan. So melatonin has a strong antioxidant property. So food strong in tryptophan, like we have mentioned, like garlic, black seed, pumpkin seeds, beetroot, should always be consumed with benzodiazepines, right? So we jump right into what we call antibiotics, right? So let's talk about antibiotics. One common drug used to treat infection is amoxicillin. Antibiotics of any kind will reduce the diversities of bacteria in your guts and change it negatively. So your low-hanging fruit will be fermented food, you know, cocktails of fruits and vegetables. Anytime you are on antibiotic, you should always consume fermented food because antibiotics will ostensibly deplete, you know, your gut microflora. That's the reality of it. Now, let's go to what we call statins, right? The most often given statin, a drug that lowers cholesterol, is Lipitor. Is Lipitor. Now, CoQ10 levels may be lower by statin. So it is believed that weariness, muscle soreness, and exercise fatigue are increased by decreased CoQ10 levels. So consuming a lot of plantains and other high magnesium foods along with spice mixtures that reduce inflammation will provide significant results, right? So that is that about statin. So we talk about biguanides. You know, since metformin raises insulin sensitivity and decreases essential glucose absorption, it is frequently administered to pre-diabetic, right? So metformin may cause vitamin B12 and folate deficiencies. Vitamin B12 and folate both reduce inflammation and are beneficial to your heart and brain. So diet high in folate and B12 may benefit from supplement, right? So anytime you're big one eyed, metformin, you should look for what? You know, you should supplement it because ostensibly they deplete vitamin B12 and folate. So you should have an alternative, you know, source or sources of vitamin B12 and folate just to replenish what have been lost, right? Now we talk about proton pump inhibitors or the PPIs. It is an over-the-counter drug, right? The notable example is what we call the pantoprazole, right? Pantoprazole essentially reduces the amount of acid your parietal cells produce. So PPI decrease magnesium levels and hinder the absorptions of B vitamins. Remember that over 300 separate enzymatic activities or processes depends on magnesium. So when used with medication, anytime you take your proton pump inhibitors, you should remember to supplement it with turmeric, with ginger, with moringa, with cayenne pepper. They will provide, you know, the lost nutrients that you suffer from intake of proton pump inhibitors, right? Now we talk about selective serotonin reuptake inhibitors, right? It is an antidepressant drug, and a notable example is the Lexapro. Now, it aids in regulating serotonin levels in the brain. Remember that 80% of your serotonin is from your gut. It's just about 20% of serotonin that comes from the brain. So this group can result salt intake. Now, sodium has a critical role in maintaining blood volume, fluid balance, and neuronal transmission. So tryptophan-rich foods, including garlic, I've mentioned this before, beetroot, black seeds, pumpkin seeds, should always be taken with, you know, selective serotonin reuptake inhibitors. Now, finally, let's look at this, oral contraceptives, right? we talk about, or rather, let's even look at angiotensin converting enzyme right here, ACE inhibitors. Now, angiotensin 2 is lower by the drug lisinopril, which decreases blood pressure. Zinc levels can be lower by lisinopril too. So your immune system ability to repair wounds, sense of taste, smell, and metabolism all depends or benefit from zinc. So taking the drug together with high zinc diet will result, in a high yield. Now we go to, why is my PowerPoint jumping? We go to oral contraceptives. Oral estrogen in any form has the potential to reduce levels of B vitamins, particularly B6, vitamin C, and then E, and minerals including magnesium, selenium, and iron. So sufficient quantities of folates are essential during pregnancy. During pregnancy, lower B6 levels may cause more nausea. So supplements may be beneficial for diets high in B12 and folate, right? So let's look at the final note. Every prescription should come with a clinical or a nutritional conversation. Every prescription should come with a nutritional conversation. And anytime you are taking any medication or these medications I have mentioned, it's always good, to monitor nutrients in long-term drug use, and then you educate the patient. When you are on a certain type of drugs, there are nutrients that would ostensibly be depleted from your system. And of course, we should always consider, the use of food where possible before we bring in drugs, right? So thank you very, very much.